Well, good morning. Can y'all hear me okay? In the back, great. I'm Randy Wyckoff. I'm the Dean of the College of Public Health here at East Tennessee State University. And I'm going to be trying to give some specific details about the health status of our region and to compare it to Tennessee as a whole and to the nation as well. Now, today I'm going to pose and answer two questions, and hopefully by the end of this entire session, not just my presentation, but the panel discussion and the speakers to follow, we'll be able to answer both of these questions. What is the health status of our region, and what can be done about it? All right. Now, for the purpose of today's talk, I'm going to focus on just a very small part of our nation. There's 3,141 counties in the United States, and I'm going to be talking about just the 8 counties of Northeast Tennessee. But if any of you are from Southwest Virginia or Western North Carolina or another part of the country, I can assure you the details of what we're talking about are exactly the same everywhere. You can take what you learn here today back home to Southwest Virginia or Kentucky or North Carolina. But for purposes of today, we had to pick one area. We're going to focus on these 8 counties, the area that we call home. It's a region of incredible natural beauty and remarkable culture and heritage, but it's also a region that faces very significant health challenges. Now, to understand the health challenges of our region, I want to take a step back and talk about the health status of the United States as a whole, because once you understand that, then you can compare our region to Tennessee and Tennessee to the nation. And typically in public health, when we're talking about the health status of a nation, we talk about life expectancy. It's the most basic fundamental measure of health. If you think about it, everything that goes into your life is reflected in life expectancy, right? How old is your mom when she gets pregnant? Does she use nicotine or alcohol or other addictive substances? Are you born in a safe environment? Do you have clean water and abundant food? Can you get an education? Can you get a job? If you get ill or injured, can you get access to health care? All of those things times 310 million make up life expectancy in the United States. And if we went out on the streets of Johnson City and we asked the man on the street to tell us 2 things about life expectancy in the United States, the first thing he would likely tell us is that life expectancy in the United States is now the longest it has ever been. And the man on the street would be right. In 2014, life expectancy in the United States was 79.5 years. A baby born today in the United States is estimated to live almost 80 years. The second thing the man on the street is going to tell us is that life expectancy in the United States is probably the longest in the world. He knows that we spend 50% more per person on healthcare than any other country in the world. He knows we have a healthcare infrastructure that's the envy of the world. But here the man on the street would be wrong. In 2014, the United States ranks behind all of those countries and comes in 33rd in the world. All right, 2.5 dozen other countries do better at this basic measure of health than does the United States. 2.5 dozen other countries where a baby born today is projected to live a longer life than a baby born in our country. And as worrisome as that is, if you look at early death rates across all 50 states, you'll see Tennessee way down there at 43rd. So here we are living in the state that ranks 43rd in the nation that ranks 33rd in the world. Okay? But as worrisome as that is, remember, our region makes up less than 10% of the population of Tennessee. So if we really want to understand the health status of our region as a set of 8 counties, we have to look at something other than Tennessee's statistics. And we've developed a way of looking at statistics here at ETSU that I hope helps put our region into a national context. So what we've done is we've taken all 3,141 counties in America using the county health rankings, all 3,141 counties, and we've laid them out by their premature death rate, their early death rate, from the healthiest county in America all the way to the least healthy county, okay? There's the median county, 50th percentile, has a value of 77.20. Don't worry what the number means. It's actually years of productive life lost before the age of 75 based on 100,000 population. It's just a measure of early death, which of course contributes to life expectancy. Now, because you can see the line is pretty level between the 10th percentile and 90th percentile, I'm going to drop the top and bottom 10% off. And I'm going to change the scale on the left. Now, this is the, if you will, the middle of America. This is the 80% of the typical counties in America. Does that make sense to folks? That's the 10th healthiest county, that's the 10th percent least healthy county. Again, the same average rate. Now what I'm going to do is take all these counties in America. There's Tennessee. Again, remember, we're below the national average. We're 43rd in the nation. And here are our 8 counties that we live in. And what you can see is that 100% of our counties fall in the bottom half of America for life expectancy, and all but one of our counties is below the Tennessee rate. So here we are in a region where our chance of dying young is considerably lower than the state that ranks 43rd in the nation that ranks 33rd in the world. All right? So I started by posing 2 what questions. I suspect most of you now are not asking what, but why. Why should someone born in our region be any more likely to live a shorter life and die younger than someone born in most other states and in dozens of other countries? Why do we have health statistics in our region that are so much less than we could achieve? And I say we know we could achieve it because other states have, right? Why do we have health statistics in our region that are worse than we could achieve? Well, again, it's helpful to take a step back and ask what we know about why people die young in the nation as a whole. All right? In the New England Journal of Medicine a few years ago, they published an article that identified the 5 factors that cause us to die young. Not the leading causes of death. We know that 2/3 of Americans, 2/3 of us will die of one of 5 causes, right? Cancer, heart disease, stroke, chronic obstructive pulmonary disease, or unintentional injury, accident. 2/3 of us in this room will die of one of those 5 causes. But what are the factors that cause us to get those diseases? That's what this article addressed. 1/3 of it's genetics, what we inherit from our family. A small amount is due to environmental exposures. Another larger amount is due to the conditions in which we live. That leaves 2 wedges in the pie. People are often surprised to learn that the smaller wedge is healthcare. What this means is that if all Americans had access to the very best healthcare, which they do not, we would reduce our early death rate by about 1/10. Now that's really important, and we have to figure out a way of doing that. But the big item here, of course, is behavior, the things we do ourselves. Right? This is what the New England Journal says we're dying from as a nation. So it's reasonable to ask, okay, what do we know about these factors for our region? Right? Which of these is causing us to die young more than Tennessee and causing Tennessee to die young more than the rest of the nation? That's the real question. What about genetics? Now you may think, well, that's kind of a weird thing to ask. But you know, there's at least a theoretical reason for it. If you look at the distribution of Scots-Irish in America, for example, we have a clustering here. And maybe there's something about being Scots-Irish that causes us to die young. I hope not. But there's at least one piece of information that suggests that's not true. Bess Brown Cooper, who some of you may have heard of, was born in Sullivan County in 1896, graduated from ETSU in 1916. For 18 months, she was the world's oldest living person and one of only 8 people ever known to reach the age of 116, which proves absolutely nothing except to suggest that maybe it's not genetics that's causing us to die young in our region. Well, maybe it's healthcare. My apologies to our colleagues, but maybe our healthcare in this region is not very good, and that's causing us to die younger than the rest of Tennessee. All right? Well, every year the county health rankings rank all 95 counties in Tennessee, and one of the areas they use is clinical care. And the top 5 counties in the state include our 2 flagship counties here. So if we're among the best counties in the state for clinical care, that's probably not the reason why we're dying young in our region. Okay? What about behaviors? Well, the Centers for Disease Control tell us what these behaviors are, the behaviors that cause us to die young. It'll come as no surprise to any of you that tobacco is number 1, followed by obesity. And then the numbers drop off pretty quickly: alcohol, infectious diseases, pollutants, motor vehicles, self-explanatory, firearms, self-explanatory, sexual behaviors that leads to AIDS and other diseases, and illicit drug use. These are the things the CDC says we're dying from. Well, let's just take a look at a couple of them and ask whether our region might be, our poor health status in our region might be attributed to this. Well, tobacco, if you look at smoking nationwide, there's Tennessee all the way down there at 46. Almost a quarter of our adults continue to smoke. 60 years after the Surgeon General identified it, is the leading preventable cause of death in our country. If you look at all the counties in America, there's Tennessee. 100% of our counties fall below the national average, and 100% of our counties fall at or below the Tennessee rate. So clearly, if we're looking for a behavior that's contributing to our poor health in this region, nicotine addiction is certainly part of that. What about obesity? You've heard about the obesity epidemic. Tennessee is 47th in the nation, the fourth most obese state. 1/3 of our adults in this state are obese. If you look at all the counties in America, there's Tennessee. This is one time where our region is not much worse. In fact, we're worse than the nation, of course, but about maybe even a tick better than the state as a whole. Now, if there's any media here, I don't want anyone walking out of here saying, Dean of Public Health says obesity not problem in region. All right? Obesity is a major problem. It's the second leading preventable cause of death, and our region, if anything, is just slightly better. But clearly, if we want to improve health, as Jerry mentioned, we have to talk about personal choices and behaviors, okay? We have to change behavior. Now, 10 years ago, this is where my talk would have stopped. I would have said, folks, we need to go out, help people change their behavior. But we're increasingly coming to understand the importance of this, the social circumstance, the conditions in which people live, what we call the social determinants of health. And it goes like this. Our health is based in part on our genetics, what we inherit from our family. It's in part based on access to health care. It's in part based on our behavior, but it's also in part based on the conditions in which we live. And if you look at that list, everything up there will make some sense to you. You can understand how those things impact people's health. But what you may not understand is how much they impact health. So I'm just going to talk about two of them. The first one being income, poverty. How does poverty impact health? Well, here's children living in poverty. There's Tennessee down there with over 1/4 of our children living below the poverty line. All right? If you look at all the counties in the nation, there's Tennessee. All but one of our counties are worse than Tennessee overall. This should matter to us for two reasons. One, it matters because poverty is very tightly bound to health care, to health outcome, okay? I could show you a lot of slides. I'm just going to show you one. This says, what's your chance of dying before the age of 65 if you're rich or if you're poor in America? And what you can see, if you use a relative risk of 1 for the rich, a poor American is 3 times more likely to die before the age of 65 as a rich American. In our country today, something as basic as life expectancy is so dramatically impacted by health, by income, okay, by poverty. The second reason this matters to us in this region is that there's evidence that in our country, the gap between rich and poor is widening over time. This is information from the Census Bureau. It looks at the poorest fifth of Americans and the richest fifth. And without going into details, what it shows is that from 1971 to 2011, the actual buying power of the poorest fifth of Americans went up by 8.5%. During the same time, the richest Americans went up by 51%, so the gap widened by 39%. And why do I tell you this? I tell you this for this reason. If you believe, as I do, that poverty is tied to health, what this means is that parts of the country with more poor people are going to see a widening economic gap and therefore a widening health gap over time. And what that means to us who care about improving health is that we've got to have economic development, we've got to create jobs in the region, because that's really going to be essential to changing the health status of the region. The only other one I want to show you is education, in part because that's the business I'm in, and it pays my salary. If you look at high school graduation, this is one time where Tennessee's actually above the national average. Think about this. In 2005, Tennessee ranked 49th in the nation for high school graduation. Now we're above the national average. That's pretty impressive. And that also tells you that everything I show you up here can change. All right? Nothing about this is unchangeable. But if we look at, now I have to change to some college, but that's just the data that I have. It's very comparable. So there's Tennessee, slightly better than the national average. And here's the counties in our region. 3/4 of our counties fall below the national average. All but one of our counties falls below the Tennessee average. This should matter to us for two reasons. One, education is linked to health. I could show you a lot of slides. I'll just show you one. This is how many more years you're going to live by age 25 based on your educational achievement. Men, women, high school dropout, high school graduate, some college, college graduate. All right? The difference is years, 5 to 7 years. If you know someone who's in high school today and they're thinking of dropping out, you can tell them on average, if they graduate from a 4-year institution, their life expectancy on average goes up 5 to 7 years and their lifetime income is over $1 million increased. It's a good investment to get an education. But it also should matter to us for this reason, and that is, just as with income, there's evidence to suggest that there's a gap, the widening gap between educated and uneducated places in the country. This is a simple chart that looks at high school sophomores and says how many of them will have a college degree in 10 years. Well, if their parents are professional, 3/4 of them will have a college degree in 10 years. If their parents are high school dropouts, less than 6%. A 12-fold difference. What that means is that parts of the country that have lower rates of educational achievement will see a widening gap in health and education, and therefore a widening gap in health. And what that means for those of us who care about health is if we want to improve health in this region, we've got to get more kids through high school and more kids through university. We've got to get a better educated workforce. All right? So I could talk about a lot of other things on this chart. I'm not going to right now. It all comes down to this next chart, okay? If we want to improve health in our region, or if we want to improve health in the United States, we have to focus on 3 things. Yes, we have to make sure people have access to affordable quality health care, including preventive services. We've got to encourage the kind of choices that help people make good behavior change, but we also have to work on jobs and economic development and education. And the single most important thing I'm going to tell you is this. These 3 things are intertwined and cannot be separated. We will not be successful at any one unless we're successful at every one. You ask any business leader here and they'll tell you the number one thing they need is a healthy, educated, drug-free workforce. You ask any educator here, they'll tell you they need kids and parents and teachers that are healthy, but they also need a robust tax base to support the school system. You ask any healthcare provider, they'll tell you they need people who have the education to make good health choices, but who also have the income to invest in their choices, okay? The most important message I can give you is that these things have to happen together, and that's why this group is here today, all right? Health improvement isn't just healthcare, it's not just economic development, it's not just education. If we want to be successful, we need to work together to assure access to health care, especially preventive services. We need to work together to encourage healthier behaviors, and we need to work together to enhance economic opportunity and improve educational achievement. And what do these 3 things have in common, of course, is we need to work together. These are not problems that Washington, D.C., or Nashville, or Johnson City can solve on their own. These are not problems that Republicans or Democrats or Libertarians or Socialists or anyone else can solve on their own. But most importantly, these are not problems that economic development, education, and healthcare can solve on their own. We've got to work together. If we work together, if we get business, education, and healthcare together, we can improve health in every part of the nation. Every state in the nation will benefit, but probably nowhere will benefit more than we do here in our 8-county region. I often say I've never been anywhere where there are more people who want to improve health than here in East Tennessee. I've been here for 8 years. I love this region. I'm incredibly honored to be at an institution like ETSU. But I close with this slide to tell you that's my great-grandfather. He was a public health officer in Virginia 100 years ago. That's my son Kevin, that's my son Greg, my daughter Kathleen. They're both students here at ETSU. And I close with this slide to make a simple point. And that is, nothing that I've talked about has anything to do with politics. It has almost nothing to do with public health. It's really about whether or not we, as the leaders of this community, can make the kind of decisions that we need to make to give our children and our grandchildren a region that is as healthy as it is beautiful. I'm incredibly honored to be a part of this panel here today. I think what we're doing today is exactly the way to move forward. We've got to have educators, business leaders, and healthcare together at one place at one time. So, excuse me, that's my presentation. Thanks.